Live Talk. Today's topic is about heart palpitations. So I've actually had many people recently come in as clients because of chronic persistent heart palpitations. And so that's why I thought it would be appropriate to hold a conversation today about that exact topic. So first, what I'll go through is what heart palpitations are. And I should preface by saying these are also can be referred to as premature ventricular contractions, or PVC for short. But heart palpitation is the more common lay term. So first I'll go through what they are, what the symptoms are, and then I'll go through what the three most common sources, reasons why I see these show up. Now, please understand this is a really big topic. There are many things that can contribute to heart palpitations, but that's why I'm saying I'll go through some of the things that I see most commonly and what I have the most success with. And then, of course, what you can do about it. So first, what are premature ventricular contractions, PVCs, heart palpitations? So normally the heart, right, the beating rhythm is set by the electrochemical gradient of the heart. Actually, it's just electrical gradient of the heart changing. And this originates in normal contractions, normal heart function. This originates in the sinus atrial valve, or SA node. And the sinus atrial node, that's where the change in conductance occurs. It sends an electrical message to that kind of cascades across the heart, starting in the ventricles, and then it sets this consistent rhythm for your heartbeat. Now, I do want to say one thing, and that is, contrary to popular belief, our heart rhythm actually isn't supposed to be the exact same all day long. That's what we refer to as heart rate variability. We used to think that. We used to think that a healthy heart rhythm was the same. It was like a metronome. It was the same beat consistently. But now we find through heart rate variability research that that's not the case. The interbeat intervals can change. So the time between each heart contraction can actually change measurably. And the more it changes, the healthier it's perceived that the heart is and that the stress response, because this is more so a reflection of what the balance in the autonomic nervous system is. Now, that's a little different from what we're talking about today, but I just wanted to share that because that's some interesting information about HRV, or heart rate variability. Now, as I mentioned, the change in conductance, it starts with the SA node, and then that travels through the ventriculars up to the atrium, and that's how the heart rhythm is maintained. But what happens with palpitations is it doesn't actually start at the SA node, it starts in the ventricles. And so when it starts in the ventricles, then we have that same conductance isn't experienced, and we have either a premature, so we have too soon of a heartbeat, or we skip a heartbeat, and that's what is experienced as the palpitations. Sorry for the dog barking in the background. So that's what accounts for the palpitations. Symptoms of palpitations are, some people don't notice them at all. Sometimes it happens very rarely, where they get one palpitation, kind of a fluttering feeling once every few months, maybe once a year. Others, though, experience dozens per day, and it can go on for many months and many years. And so that's more so what we're focusing on here. So the most common symptom is that kind of fluttering heart feeling, right? Feeling like your heart skipped a beat. Sometimes it feels like a lightness in the chest. A flutter is the best way to describe it. Some people can feel a little dizzy or lightheaded when this is happening, though that would be if there's many consecutively. But that's the most common symptom. It's just kind of that flutter feeling, that kind of light feeling like your heart skipped a beat. So now let's talk about some of the most common causes that I see, because I would like to first say, like I said at the beginning, there are many. So chronic heart palpitations can be so mild as just stress and anxiety, the causes, up to looking at issues with like coronary artery disease or heart disease, or sometimes COPD, because it can be from a lack of oxygen delivery to the heart. So there's many different aspects to consider, and that's why it is very important to, if you're experiencing heart palpitations frequently and for a long time, I would definitely start by seeing your primary care physician. They may refer you to a cardiologist, get an echocardiogram, other formal diagnostic testing to rule in or rule out anything serious. If the doctor says, nah, looks like it's just regular old run-of-the-mill palpitations, PVCs, then that's where we can start to look at the more functional aspect of things. So first factor that I want to mention, as far as most common underlying causes, would be mineral imbalances or deficiencies. And remember that electrolytes like sodium and potassium are also minerals. So that I'm kind of lumping in minerals and electrolytes. So with the onset of palpitations, this is the first place I go. Magnesium being a really big one. Sometimes calcium's paired in with that. Magnesium deficiency is more common. About 75% of the population is deficient in magnesium because there's a very high demand for the mineral, and it's short supply in our food sources. So magnesium is a great starting point, magnesium deficiency. I like magnesium glycinate, sometimes magnesium taurate, specifically for heart rhythm and for muscular contractions. Like I said, sometimes calcium can be paired with that. So starting with like a calcium magnesium blend, for example. And then also looking at electrolytes. So especially anybody listening, I know I have a lot of people that live in Florida. Anybody listening that lives in a hot, humid, environment. That's another place that you would want to start is, have you been outside doing a lot of work and sweating? Sometimes just supplementing with electrolytes can help tremendously. I prefer an electrolyte blend. A great brand that I found at most grocery stores is called Ultima, Ultima. Do that a few days per week. Just put a packet in your water, maybe 3 days or so per week, and see how that helps. Same thing with magnesium. Take anywhere from 200 to 400 milligrams. Sometimes I often have people go up, and we dose that based on bowel tolerance. But nonetheless, starting there and see if that helps. If not, if you've tried those things, nothing's working, then the next place I go is stress. So I say hormone imbalance because hypothyroidism, hyperthyroidism can cause this. Testosterone abnormalities can cause this. But I'm going to focus today on excess cortisol and adrenaline. And so when we talk about cortisol and adrenaline, I gave a whole conversation last week, 2 weeks ago, about adrenal function and adrenal fatigue, and talked about that there's actually 3 different types of stress, right? There's 3 different categories of stress. So you might be listening to this thinking, I don't feel emotionally stressed though, but you might be chemically or physically stressed. So in all 3, chemical, physical, and emotional stress, all increase cortisol and can all increase adrenaline, epinephrine and norepinephrine. And so there we can test that. We can do either a salivary or a urinary test for cortisol. There are urine tests for adrenaline as well. So those are things that I would consider, and especially we have to take into consideration the whole picture, what the whole person's picture looks like to make that determination. But looking at stress, that is a very common contributor to palpitations. And with this, not only would we want to find the source of the stress, is it chemical, physical, or emotional, but looking at just some kind of baseline foundational things that you can do to support stress. Breathwork is huge. So mindful, deep, slow breathing throughout the day, and especially if you feel the palpitations coming on, that can be a game changer because the breath is the only voluntary system that we have between the 2 branches of the autonomic nervous system, the parasympathetic restful side and the sympathetic fight or flight side. So starting with breath work, I'm also a big fan of neurofeedback and biofeedback devices. So I've been a big promoter of the Muse meditation headband that helps calm your brain waves. It uses sound to help guide you into the calm, relaxed brainwave state. and also HRV training, heart rate variability training, that guides you through certain breath work to get your heart into more coherence can be very helpful. And that's also working at a lot of the underlying causes too. It's not just a symptom relief. It truly is activating, like supporting hormonal and immune and different functions. So first were mineral and electrolyte imbalances or deficiencies. Second is looking at hormone imbalance and stress, high cortisol and high adrenaline. The third that I'll mention that I see very commonly is toxicity. Now, please understand this can be from environmental toxicity, like organic environmental pollutants. It could be from like heavy metals, plastics, things like that. It can also be from, and this is what I'll speak to more because this is very common, mycotoxin toxicity. So mold, in other words. One thing that I see very frequently is people that have had exposure to mold and they don't have the proper immune defense mechanisms in order to prevent that from becoming a serious issue. Palpitations are, I would say, 85 to 90% of the people I work with mold, those are the ones that are experiencing dozens per day for long periods of time. And when we look at blood work, we'll often see correlations in having low minerals and even low minerals and low electrolytes, sometimes low potassium, like lab low potassium, sometimes low sodium. And so in those cases, supplementing with electrolytes can definitely help, but we have to see, why are you not able to retain them in the first place? Is aldosterone, another mineral corticoid hormone that follows cortisol, is aldosterone being affected? Is cortisol being affected? What does hydration status look like? That's a really big one. But looking at mold, so mold has, I'll start by saying 75% of the population can build antibodies to mold. And so the effects of mold toxicity are milder, sometimes like some slight congestion, maybe cough, but nothing significant. 25% of the population, though, can't. And so in those cases, the mold toxins actually bind to cell receptors and block normal metabolic functions. It stimulates the it suppresses the innate immune response. And so it leaves us open to other forms of infections. Bacterial, fungal being a really big one, sometimes parasitic like Blastocystis hominis or Indolemax nana, these protozoan parasites. And then with mold also, there's a really significant impact on both the detox systems, so liver, kidneys, lymphatic system, as well as the nervous system. So one of the most common presentations of mold are neurological in nature. Brain fog, severe, really intense anxiety, significant fatigue, pain. So those are some, and then also like shock type symptoms or feelings like your limbs are falling asleep really often. So that's where, I'll have to do another talk just on mold because there's this whole conversation that we can have. But the last thing I want to mention with mold is, the most common pathway of exposure is through inhalation. And we can appreciate that the nasal, I totally just blanked on the name, but the nerve that connects the nose to the brain, that nerve, I thought I had it for a second, leads directly to the limbic system. And the limbic system is what controls our hormone output to a very large degree. That's where the hypothalamus is, the pituitary that, like I said, regulates, it's the endocrine center, and also our emotional center and the hippocampus, which regulates the stress response and circadian rhythm. So I should say hippocampus regulates the circadian rhythm. The hypothalamus, pituitary, adrenal axis, though, is also in that area. And so that's where we can see a really big correlation with these autonomic dysfunctions, these features of high adrenaline, high cortisol, sometimes high norepinephrine, dopamine, all of those that can then affect the palpitations in the heart, in the cardiovascular system. So those are, like I said, some of the main sources of chronic long-term heart palpitations that I see. And I'll blanket statement by saying mineral support 9 times out of 10, even if there's mold, even if there's stress, even if there's these other things, mineral support is a really important starting point. I'll use different forms of minerals depending on the person that I'm working with, but minerals are a baseline and electrolytes are a baseline. And then from there, it becomes really important at identifying what those underlying causes are, because there's going to be totally different approaches if we're working with mold versus if we're just working with chronic emotional stress versus if we're working with, whatever else it might be. So that becomes really critical. And if it is mold, then we need to start supporting your body's ability to detox it safely. And your body will determine how fast we can move in that process without throwing you into what's called a Herxheimer response and flaring things up. And it will also, there's certain things in place that we need to do in order to safely do that, certain different protocols and processes, if you will. So nonetheless, that kind of gives you an idea. The last thing I want to say too, just kind of throw this in there real quick as far as like what else you can do about it. So starting with mineral supplementation, I like the Ultima brand. And as far as over the counter goes, and then minerals within fulvic acid, a fulvic acid concentration. Trace Minerals is a brand that sells this. That can be really helpful too, because fulvic acid helps with exchanging nutrients and waste. So it also supports detoxification. So minerals as a starting point. Breathwork, especially as the palpitations are coming on. Deep, slow breath in through the nose, specifically out through the nose. Do that several times per day, and that helps mediate the stress response. And then the third is what I was going to suggest from a nutrition perspective. Identifying food sensitivities is really big, because a food sensitivity at the end of the day is a form of chemical stress. And so if you eat a food you're sensitive to, you release adrenaline and cortisol. And so there can be a direct connection between food sensitivities and palpitations. One that I see very often is to gluten. So there's a really great book written by a cardiologist called Wheat Belly. It's really popular. Most of you have probably heard about it. But Wheat Belly talks all about the effects of gluten on the cardiovascular system specifically. And so if you're listening to this, you have palpitations all the time, it would be worth, if you haven't already, it would be really worth experimenting with going gluten-free too. And then we can formally test for other food sensitivities as well. All right, and then the last piece of advice, as always, is work with a professional to help you find the underlying root causal factors to what's driving your palpitations specifically. First and foremost, if they're happening frequently, talk with your doctor, possibly a cardiologist, have some advanced testing run to make sure there's nothing serious at play. And if the doctor says, which they often do, looks like it's just your run-of-the-mill palpitations, should be fine, then you can work with a professional like myself, a functional medicine doctor, or someone that can help guide you to finding the underlying causes and a natural therapeutic solution to restore health long-term. All right, everyone, I hope that was helpful today. Thank you for tuning in. Looks like we got some great visitors. So glad to see you as always. Okay, thanks so much, everyone. Have a great rest of your day. Bye.